Let's start this discussion. We're here in Paducah, Kentucky. We are hearing different things from people wherever we're going, but I haven't found too many people around here who are opposed to reforming health care.
My understanding, there is about 48 million people that's not covered. Those people need to be covered. For the people that already have health care, that's fine. But we're talking about people that don't have coverage. And to have some type of coverage is better than not having any.
What's your opinion on this debate?
Well, my husband and I are two of that 47 million plus that don't have health care. And I'm not talking insurance. Of course we don't have insurance, but I want health care. My husband has diabetes and he just had a bout with cancer. What insurance company is going to cover us? There aren't any. And unfortunately, in Western Kentucky, we have two of the most worthless representatives in the nation. You know, McConnell's spewing all of this garbage, and Whitfield, who knows where he is. So they don't hear, and they don't care, and they don't feel what the average American feels. We don't have health care. If I get sick today, where do you think I'm going? I'm going to the emergency room. Who's that costing? That's costing us, the taxpayers. So if it's going to cost my bottom line, if they have to tax me more in order to get health care, tax me. Tax me, tax me, tax me. I am willing to pay, as long as I can go and get a pap smear every year.
Tell me something. We pulled this bus into Paducah. It's on our route from Atlanta to Des Moines. We're stopping in a lot of places. There's no setup here. We pulled the bus in, and yet I haven't yet met somebody here in this crowd. And tell me if I'm wrong. Put up your hand if you think this is the wrong thing to do, to reform health care right now. Is there anybody who thinks health care reform is not the right thing? You think it's not the right thing to do right now?
No, I don't think it is.
Why is that?
Well, the economy's bad already. I'm paying enough taxes.
All right, so
that's ridiculous. Okay, seriously. What do you think you're paying right now in taxes? You're paying for me to go to the emergency room because I stubbed my toe or because I have a toothache.
What about illegal?
What premium? What premium? What insurance company do you think is going to take on my family? Are you serious? Seriously.
May I say something?
Yeah, you don't know my family. You don't know anything about the situation, but you're willing to pass judgment and say that I'm not willing to pay a premium. I'm willing to pay a premium. I'm willing to pay higher taxes. I'm willing to do whatever it takes to make sure that every single person in this country is covered by health care. That's not too much to ask. We're the richest nation in the world. We should cover every single citizen. I'm a veteran of the United States Navy. Are you saying that I don't deserve health care? Because I believe that I served this country, my husband served this country, my entire family served this country.
I would really love to drive a Hummer. They're cool cars. I can't afford one, so I don't drive one. I drive what I can afford.
Oh my God. I can't believe you're saying that people don't deserve health care if they can't afford it.
Where did I say that, Heather?
That's what I hear you saying.
Then you're not listening, Heather.
Yeah,
I
hear you.
Well, you did say that you'd like to buy a Hummer and you can't buy a Hummer because you can't afford it. So you're saying if you can't afford you can't afford the Hummer, you don't drive it. If you can't afford health care, you shouldn't get it?
No. I'm saying you have the basic stuff. You get a catastrophic illness, you're in a car crash, an accident, something like that happens. Of course you get coverage for that. That's the kind of thing. When it comes to,
okay, let me interrupt you. Here's the problem. The basic stuff is pregnancy. These are considered pre-existing conditions that no insurance will touch with a 10-foot pole. And the problem is, when they do touch it, the costs are more than what the hospital would charge you. So here ends the conundrum, and there's where the reform is needed. So, I mean, everybody needs health care, granted, but the things that insurance companies don't cover that need to be covered is where we're having our problem. Because the people aren't going to buy the insurance, they're going to go pregnancy, pap smears. Most women's issues as far as health
most of those are
have to be regularly looked at.
They are not. They don't even
cover
birth
control pills.
For a woman, I know.
They are not
Insurance
covered.
will not cover it. It's considered, pregnancy is considered for a woman by an insurance company a pre-existing condition. If I'm lying, I'm lying. I've read the
Brother, I work for a women's organization. I'm telling you, she's telling you the truth.
All the congressmen and senators got the good health care.
They sure do.